if you can put the power of diagnosis for certain basic health condition in the hands of, then you will be solving a significant problem. And that is where home use medical devices comes in. Now, I always tell people, I say, the money shouldn't be the first consideration. Your life, your health should be the first consideration. We don't consider these things when we want to buy an iPhone. We don't consider these things when we want to buy a laptop. We don't consider when we want to buy a car. Why should we consider money when we want to buy a device? You should go for what will actually give you the results and the numbers that will actually help you to truly take charge of your health. I think the problem really is that most people don't want to use those devices at all. Some people still don't see the need to use them, especially when you talk about young people. Young people don't believe they should check their glucose monitor, their glucose level. Young people don't believe that they should check their blood pressure. So the risk is actually in not checking, if you ask me. The best way to prevent is to be one step ahead of the disease condition. And home use medical devices, especially the ones that you can use both when the condition is present and when the condition is absent, are excellent tools. Technology is revolutionizing the use of home use medical devices. In fact, that is the one place that is being disrupted the most. In time, there is a possibility that practically everything that you see on this table will end up inside your telephone handset. It's just a matter of time.
Yes,
that's where technology is going. So there's going to be that disruption.
Welcome to Seco Direct, where we explore the latest advancements and tools that empower individuals to take control of their health. Today, we're diving into the world of home diagnostic kits, a revolutionary tool that allows people to monitor their health conditions from the comfort of their homes. Now, in recent years, we've seen the rise in the usage of home healthcare monitoring devices and diagnostic devices. What are some of them? We have things like the blood pressure monitor, like so. We also have the blood glucose monitor, or known as the glucometer, which looks like this. Then we have the pulse oximeter. The pulse oximeter, which is used to measure oxygen saturation and heart rate, which is like this, you put in your thumb. Then we have the thermometer. So the thermometer is used to measure temperature of the body. Of course, you can measure it by putting it in your armpit, or putting it in your armpit is most likely the most common one that is being used to measure temperature. Then we also have the nebulizer, which converts medication into mist for inhalation. Now we have other things like the oxygen concentrators, which provide supplemental oxygen, CPAP machines that treat sleep apnea, inhalers that deliver medications into the lungs. We also have things like ventilators that support breathing in patients with respiratory failure, wound vacuums and wound dressing kits, which provide materials for wound care, ultrasonic wound cleaners, which clean and debride wounds. We also have things like the ECG machines that measure heart activity, urine test strips that detect various health indicators as seen by your urine, infusion pumps and insulin pumps that deliver insulin into individuals with diabetes. Then finally, we have portable defibrillators that are compact and portable and are used in cases of emergency for patients that possibly have cardiac arrest. Now, the list is endless, and we understand the reason for these devices because they are easy to use, they are very convenient, and therefore accessibility. They also ensure early detection, regular monitoring, and better management. But of course, there are still some gray areas that we would need to understand, and I'm sure our viewers would also like to understand. And to help us unpack this, we have Mr. Ogene Ochuko Omaraye joining us, a licensed pharmacist with over 20 years of experience in patient care and diagnostics. Thank you for joining us here today, Mr. Ogene Ochuko.
Thank you.
Now, let's get into some of the questions that we have for you today. So, do you agree with a lot of what I described in terms of the characterization of these products and essentially how they are beneficial as to how they were portrayed, as how I said them? Because to start with, can you help us explain what home diagnostic kits are and how they work?
Okay, thank you. Pleased to be here to share ideas and thoughts along the benefits of home diagnostic kits. Basically, home diagnostic kits are, just like you rightly said, devices that is supposed to help people take care of certain minor ailments and diseases in terms of diagnosis. We live in a country, for example, in Nigeria, where the medical system is not as sophisticated, and it is also not able to attend to the population. And so, if you can put the power of diagnosis for certain basic health condition in the hands of people, then you will be solving a significant problem. And that is where home use medical devices comes in. It's just to take care of things, disease conditions, minor ailments that that occurs in homes.
Okay.
You are able to do things like take care of things like check your blood pressure by yourself. You don't have to go to the hospital every now and then for you to be able to do that. Why? Because there's a device that is smart and compatible and you can use it at home. You are able to check for blood glucose, which is also very common, like you rightly mentioned.
Yeah.
You don't need to go to the hospital. You can monitor it at home while taking your medications. Things like malaria, simple stuff like malaria, you can do a test. Malaria is probably the most common disease in Nigeria.
Yeah.
Interestingly, it's not every case that is actually malaria, but you can actually detect that by a simple test cassette. The same way you use a blood glucose monitor, you use a malaria test cassette. And you know if you have malaria or not before you do treatment. So home use devices are devices that you don't need a professional, a healthcare professional. It's something that an everyday person can put to use. Yes, that's what is referred to as home use medical devices.
Okay, thank you, sir. So we believe, like right now, that there is an increase in these adoptions of all these home diagnostic kits, like home healthcare monitoring. Is that the case in your estimation? Do you believe that that's the case, that there's an increase in the adoption of these things?
Yeah, absolutely. People are getting more aware of the fact that they can do certain things to a basic level at home without having to rush almost immediately to the hospital, especially in the face of insufficient medical facilities to attend to them. So yes, we see a trend in that direction.
Now let's move on to chronic conditions. Now, what are the benefits of using these home diagnostic kits in the case for like hypertension or for diabetes, for instance? How do they come in impacting treatment of those, or as the case, management of those chronic conditions?
So, chronic conditions, like you rightly described, is a long-term condition. So
Yes.
most times these patients are going to live with these conditions for life. And they can't live in the hospital for life, so they have to be at home. Now, for hypertension, for example, these home use medical devices like the blood pressure monitors, you are able to monitor your blood pressure to know if the medication you are taking is controlling the numbers or not. And if it is not, because some of these devices come with records, you can take those records to your medical doctor to say, look, do an analysis, do an assessment to see if this medication is doing good with me. And one interesting thing we've also observed too, it's you are a medical doctor, you understand this. It's called the white coat hypertension. Some people tend to get realistic numbers when they check at home versus when they go to a health facility. Because immediately they step into the health facility, there's this apprehension which is not there. If they have to do these things at home, they are a little bit more relaxed. And so you actually see the granular information that you really need to know about that particular patient. So it's an essential part of chronic disease management, if you ask me.
Yes, I agree totally. So another thing that I would like to touch on is, you already mentioned it about how, when you measure your BP at home compared to when you go to the hospital, you can see some difference because people have white coat hypertension. Now, for some people, they might judge that as, okay, maybe the accuracy of this monitor that I'm using or this diagnostic kit I'm using, it's not right, because when I'm at home, I'm always getting normal numbers. But when I'm at work, at the hospital, and they are giving me the BP, it's giving me something else. So can you speak to the accuracy, just to keep our viewers at rest as to how accurate are these home diagnostic kits?
Yeah, so that is a very, very important question you just asked, because a lot of home diagnostic kits are out there, but there are few that are validated. Okay? If you permit me, don't mind me. The Omron blood pressure monitor, for example, is probably the only one in Nigeria today that is clinically validated. And what do we mean by clinical validation? It means that in designing the product, they've used it to benchmark a typical traditional SFIG, mercury SFIG, over time, and they found out that the results are consistent with the results you get from using a blood pressure monitor like an Omron blood pressure monitor is consistent with what you will get when you use the traditional mercury or aneroid SFIG device to measure the same blood pressure monitor. So a lot of these devices, not just the blood pressure monitors, the blood glucose monitors, they are all clinically validated. So they are benchmarked with the traditional laboratory tests that you carry out for blood glucose, for example. You use a blood glucose monitor like a BG check machine. The results are consistent with what you get in the lab. You use a blood pressure monitor like the Omron blood pressure monitor. The results are consistent with what you will get in your doctor's office. And over time, these have been proven with all kinds of institutions, the British Medical Association, the various associations in Nigeria, for example, the Hypertension Society of Nigeria and the NMA. They've worked with these devices over the years, and they've seen that these validations are actually, as it is said, with all international best practice. So I agree with you. Accuracy is a very important issue, and people should not just buy any home-use medical device for the sake of buying. They must, because if you get wrong readings, it can actually aggravate the health outcomes.
Yes.
Your blood pressure monitor, for example, we keep going back to the blood pressure monitor because that's a readily available one we can refer to. It's telling you your blood pressure monitor is under control. Meanwhile, the thing is not under control. You need to use the right device as far as home-use medical devices are concerned.
Yeah. So a lot of people, dealing with hypertension or dealing with diabetes, for instance, how can you assure them that them self-monitoring these conditions using these home diagnostic kits is what is essential to get them ahead of controlling their chronic conditions? Because they have to have this real-time data of what they are measuring. Okay, my blood pressure is controlled and everything. So how can you assure them that these home diagnostic kits, if they're self-monitoring, it's actually accurate, it's actually what is best for them to have a proactive lifestyle in controlling their chronic conditions?
So a lot of them usually have what you call doctor's appointments. So at home, in between doctor's appointment, they use some of these devices, and the idea is you use them, keep your records. When you are going to the hospital to see your doctor, go with those records. Interestingly, some of these devices are not so sophisticated that you can actually send your readings ahead of you to your doctor. If you pick the right ones. Most of these devices are available already in the market, like I said. But the idea is when you send those records to your doctor also carries out tests when you come for your doctor's visit, and they see and they can compare. Now, I can assure you that if you have used the right device over a period of time, the results will be consistent. And that is very comforting. Why is it very comforting? Because in a way, you will have succeeded in putting the health outcomes in the hand of the patient. I always tell people, I say, there is no doctor, there is no pharmacist, there is no healthcare provider that will love you more than you love yourself. And there is nothing better than having absolute control of your health if you can. And these devices just put the power in the hands of the patient. Of course, in conjunction with their healthcare providers. But it brings a lot of assurances in terms of the outcomes that we are all expecting.
There are a lot of home diagnostic kits that posit themselves as, okay, this is cheaper. I wouldn't want to go and get a high level or clinically validated one because it is above the cost that I have or something that I can afford. So how can home diagnostic kits come into play in making sure that that is not an issue? Cost and accessibility and affordability is not an issue for the normal or the regular person out there.
Okay, so again, regulatory comes in at this point, right? We always say, for you to use a device, ask questions. Is it registered by our regulatory bodies? NAFDAC is the agency in Nigeria that is in charge of registration of most of these devices. Is it registered by NAFDAC, for example? 2, is it recommended by your healthcare provider, because they know these things, they know which is best. And then the last decision that you should consider in terms of all of this is your affordability. Now, I always tell people, I say, the money shouldn't be the first consideration. Your life, your health should be the first consideration. We don't consider these things when we want to buy an iPhone. We don't consider these things when we want to buy a laptop. We don't consider when we want to buy a car. Why should we consider money when we want to buy a device? You should go for what will actually give you the results and the numbers that will actually help you to truly take charge of your health. And that's why money shouldn't be. But we live in a country where a lot of these technologies are not yet ingrained in our society. So practically everything is import dependent. We are relying on foreign support for these devices to be made. But the most important is that we are making them available to our people, right? So there's the tendency for that extra cost to come in. But I think the peace of mind you get from buying the right device is more important than the cost of paying for that device, as long as it does what it says to do.
Yeah. So you already spoke about how a lot of this is foreign backed, like a lot of the home diagnostic tools that we get are foreign backed. So now that's one thing. Now, how do we then integrate this in terms of how people can send data to their doctor? You already spoke about people can also send data, but I'm not sure that is something that is readily used now, where some of these home diagnostic kits can send it to your doctor. But so moving ahead, that will come along. But how can that be integrated as of right now in terms of these home diagnostic tools or kits being a bridge between the patient and the healthcare provider?
Okay, so like I said, it's already available. A typical example would be the Home Run M7. They call it the Home Run M7 IT. It stores all your records in the cloud, and it gives you the opportunity to share with your doctor, with your family members, especially for those of us that have old parents at home. They can check these things. It's in the cloud. You can check on their behalf. You can say, Dad, Mom, your numbers are going up. What's happening here? Are you taking your medication? And stuff like that. So these are already in place. For blood glucose monitoring, same thing. You can actually upload your numbers into your phone, and then you can send the details and the data to your medical doctor, to your family, to anybody who plays a role as far as your health is concerned, doctors, pharmacists, whoever plays a role as far as your health is concerned. So these things are actually already available in the Nigerian market.
All right.
Now, you talked about localizing medical devices. A couple of companies are beginning to look inwards to say, look, yes, we rely on foreign finished products, but the government of the day, as well as the regulatory agencies, are beginning to encourage people to look and see how they can do backward integration to get some of these things manufactured locally, so that they can be adaptable to our own and local needs, as the case may be.
Are there any limitations or any risks that are attached to this home diagnostic case? Is there anything that we need to look out for that might actually be a problem?
That's a very interesting question. It all depends on the device that we are talking about right now. Okay. But the risk had been mitigated by the fact that doctors give appointments to patients. So from time to time, there's these checks and balances. I think the problem really is that most people don't want to use those devices at home. Some people still don't see the need to use them, especially when you talk about young people. Young people don't believe they should check their glucose monitor, their glucose level. Young people don't believe that they should check their blood pressure. So the risk is actually in not checking, if you ask me, not in using these devices, because it's in checking that you find out if there is a need for you to escalate a health condition based on the parameters that you are seeing from your devices. I think the risk is very, very limited, if there is any, as long as you are using the right device and then you are keeping to your doctor's appointment, which kind of compensates and compare whatever it is that you are seeing already at home.
Yeah, so you brushed on it now, and you were speaking to how young people don't want to check their BP or check their blood glucose. So are you advocating for these home diagnostic kits to actually be a staple of the household, regardless of if you have chronic conditions or not?
Absolutely.
Okay.
You are a medical doctor. You know there's prevention. There's curative approach to disease and treatment management and all that stuff.
Yes.
The best way to prevent is to be one step ahead of the disease condition. And home use medical devices, especially the ones that you can use both when the condition is present and when the condition is absent, are excellent tools. I give a typical example. Very everyday use, a bathroom scale, right?
Yeah.
The only way you will know that you are gaining weight is if you use your bathroom scale often.
Yeah.
If you don't use it often, you will wake up one morning, you were weighing 70, now you are weighing 80. But if you use it very often, you will see when the needle is climbing, and you say, no, let me start to do my exercises, let me start to watch my diet and stuff like that. It's the same thing with the devices. So if you check your blood pressure, for example, regularly, when I say regularly, for younger people who don't have any health condition, once a week, once a month, once a quarter, just check. It doesn't cost you anything, right? And you will detect if there is anything that is unusual. It is easier when you detect it early enough to be managed than when it becomes a full-blown health condition. And nobody is really exempted from any potential full-blown health condition that can happen.
Yes, I totally agree. So now the thing is, we've seen how these home diagnostic kits how far they've come. So are there any advancements or any exciting changes in front that, that would push the level of this home diagnostic kits to a different level? Because let me give you an example. For instance, during my medical school, I used to have a stethoscope, and the stethoscope, we used to make this joke that I can't really hear what the doctor said they are hearing, but it's there.
It's there.
Yes, but from towards the end of my house job, I started really seeing stethoscopes where you just put it and it's loud. It's it's technologically advanced, and that is just a stethoscope. So are home diagnostic kits moving towards that type of thing?
Absolutely. I mean, we talk about AI every day. Yes. People are beginning to incorporate technology in so many ways. Just like I had mentioned earlier on, even the one that you can check and the results are uploaded in the cloud. Technology is revolutionizing the use of home use medical devices. In fact, that is the one place that is being disrupted the most. In time, there is a possibility that practically everything that you see on this table will end up inside your telephone handset. It's just a matter of time.
Yes,
that's where technology is going. So there's going to be that disruption. And it becomes a lot more sophisticated, but more accessible and available to as many people. So all you need to do is just own a phone, and you'll be able to do so many things. Right now, there's still a bit of in terms of the quality assurance of the test results that you use with your phone. For example, you do your step counting exercise, your phone is able to count it. Pulse rate, your phone is able to do it. You're not able to do the blood pressure yet. Of course, blood glucose, you can do it and connect it to your phone. So phones are actually being used as a technological disruption to create new opportunities for the use of home use medical devices.
Yeah, I'm excited to see how far they're going to go, because phones before they started somewhere, but now they started putting pulse rate, step count on this. So we don't know what it would be in the future. Yes,
exactly.
Thank you so much for sharing your expertise on home diagnostic kits. I've really learned a lot, especially with regards to home diagnostic kits with blood pressure, with nebulizing, because before you even came here, I was disputing if a nebulizer is an actual home diagnostic kit. But with this discussion, of course, I can yield that it actually is a home diagnostic kit.
It's a lifesaver. It's not just a home, it's actually a lifesaver. I mean nebulizers, because if you get an asthmatic attack in the middle of the night and your healthcare provider is not there, the only way you can manage the situation until you get to the hospital is to nebulize.
I agree. So that's this to say that these tools are not just convenient, they are transformative, and they help to manage our health. And to our viewers, if you're living with a chronic condition or simply want to stay on top of your health, consider exploring home diagnostic kits as part of your wellness journey. Here at Secondary, we already always talk about being proactive with your health care. Now, remember, knowledge is power, and taking small steps can lead to a healthier tomorrow. Thank you so much for watching Seco Direct. Don't forget to like, share, and subscribe for more episodes. And until next time, please do take care of yourself and be proactive with your health.